Hello, good afternoon. I am Dr. Sanjay Sharma from JPRC Spine Center. I'm an interventional pain physician, and today with me is Dr. Charles Ten from Philippines. He's the neurosurgeon, right? And basically, our topic is how to manage your back pain and what is the possibility with this medical treatment or the surgical treatment. Okay, Dr. Charles, just tell me what exactly the scenario of the low back pain in a common people in your Philippines or in India, because from last couple of days you are in India with VV people and seeing many patients of this low back pain. So what you find exactly?
Low back pain is common. It is a very broad diagnosis if you have a low back pain.
Yeah.
In fact, 70 to 80% of people have low back pain. So low back pain means a lot. It's from muscles to bone to spinal cord and nerve roots.
Okay.
So it's a broad diagnosis.
It's a broad diagnosis. Exactly what in the majority of the cases what you find, because sometimes the patient is having low back pain due to the posture, sometimes due to the muscle, sometimes due to the ligament. Ever you find there's some hidden etiologies over there, like tuberculosis, like tumors, like I mean to say meningioma, means sometimes the fracture, and patient is ignorant about these things and just taking the treatment for this low back pain. Is it justified? Do you think? Is it justified?
Justified to do treatment?
Yeah, justified. They are taking the medical treatment without knowing. On the plain X-ray, they are taking the treatment. Is it justified?
I observe in India also, same as in my country, there are people who go to medical treatment first, and some doctors ignore the fact that there are some other problems like tumors, and common in our country is tuberculosis in the spine. So for this, I don't think it's justified. If there's really clinical problem or neurologic deficit, we should do further testing.
I'm asking very simple question. Most of the doctors just they're going with this investigation, preliminary investigation of the plain X-ray.
X-ray.
Is it justified? If
No.
there has a good modality like a CT scan, MRI, and there are other modalities out there, just to play with the life of your human beings, is it justified? I don't think so.
No, it's not justified. An X-ray will just only show the bony structures.
Yeah.
It will not show the spinal cord or the nerve roots. Or
Yes,
any
it never
structures.
show. It's never show because you cannot see in this. Only in the MRI, I think is a
MRI is the gold standard.
Is the gold
for spine.
standard. So everybody should have this MRI for before having any pain problem like your back pain or yes, long-standing chronic back pains. You may have any kind of a tuberculosis or tumor or any kind of a fracture without noticing, because ultimately who is the sufferer? You are the sufferer. Your doctor is not sufferer. You are the sufferer. Ultimately you have to pay the price for that. So just tell me this, Dr. Charles. Is any because other than this medical treatment, how long it has to be taken for the medical treatment, just for the trial?
For trial medical treatment?
Yeah, medical treatment. How long a patient can just go with the trial with your consulting doctor?
Usually it depends on the patient. For conservative treatment, you mean? For medical treatment, it depends on the patient. But usually if you go a couple of weeks to a month, then
is it
if
fine?
it's not effective, you should do surgery.
Yeah. That is my main question. Up to a certain week, he can make a trial for this thing.
Yeah.
If it's getting improvement just within a very good manner, then it is effective, right? You can go with this taking bed rest or exercise or medical treatment. I mean to say painkiller and physiotherapy now also.
Correct.
If it is not getting benefit, then you have to think for the surgical option with the neurosurgeon. Right? I think is the best option for the neurosurgeon.
Yes, correct.
Yeah. Other than so-called spine surgeon, it's a neurosurgeon. I think the best option.
Yeah,
so, what are the modalities do you think is good for surgical intervention for this? Because most of the people get scared about the surgery. I mean to say, they say because some sort of a confusion in the society. If they underwent for the surgery or the spine, they may get paralyzed. They may get just loose of the bowel and bladder movements. Yeah, because everybody is scared about, because in the past the surgery which was sometime with the side effect in a 0.01% some cases were reported there, and the people think the most of the 99% cases. Is it true?
Yeah, in any surgery there is always risk, but it's not true that all surgery will succumb into paralysis.
Yeah.
So with good training and a good hand technique, especially for neurosurgeons who are used to operating on delicate skin, especially delicate organs like the brain and the
Yes.
spinal cord. So you never go wrong if you go with these people.
Yeah, because it is a very sensitive organ. Because the spinal cord is the one just like a brain. These are the two controlling authority. First is the brain. Second one is spinal cord.
Yeah.
If something is happened and a misdirection way, it may lead to some catastrophic
Catastrophe or
reactions.
paralysis, which is.
Do you think any role of this pain management for the non-surgical intervention if somebody want to avoid the surgery?
Yes,
Yeah, yeah,
definitely.
So, what are the probable things which are seen in US and other countries where you have traveled or get the training or just doing practice in this? Yeah. What exactly your opinion about the minimal invasive or the interventional techniques?
Yeah, in Korea, aside from physiotherapy and pain medication, they do injections.
Yeah.
And if not, they will go to minimally invasive spine surgery.
Yeah.
Which is, for me, it's one of the
Best
most
option
effective.
is the most effective
Best
option other than just to make a surgical trial.
Yes.
Better we should go with just like a nucleoplasty, facet block, diagnostic block,
Correct.
vertebroplasty, kyphoplasty. Yeah,
Correct.
because they are just day care procedure and the patient can get a treatment and the same day or after the 24 hours depending
They
on the
can be
clinical
discharged.
situation they can be discharged
Yeah.
right now. So okay.
So shorter hospital stay, smaller wound
Incision. Yes, yes.
and less destruction to soft tissues.
Yeah, that has to maintain the integrity of the tissue.
Yeah.
First prime motto is that for me. How do you find there's a minimal invasive technique for the spine? You mean to say if the case of the disc prolapse or the nerve compression, the basic problem which people think any back pain is means sciatica, slip disc, something like that. So what exactly you want to say for such type of a cases? What should be the best probable way?
Best surgical option, you mean?
Yes, I mean to say.
For minimally invasive.
Yeah.
Minimally invasive is it's kind of straight up surgery. You go straight to the problem and you check the problem. You get out the problem. You get the problem out. So I think it's the best.
So without making any incision, how much incision we will make for this thing?
That's a
Is
very
it training
small
from millimeter to centimeter,
Yeah.
not like a conventional surgery in
Not
the
like the conventional.
inches or something like at the 15 centimeter or 10 centimeter. The
Yeah,
patient
yeah.
is feared
Correct,
about
correct.
whether it is really healed or not, right?
Yeah.
So okay. So it is all about our discussion about the spinal pain management and a surgical option and how we can manage the thing and what are the precaution which we should have and what are the indication and what are the restriction we should have. And I am very thankful to Dr. Charles. He's from the Philippines, the neurosurgeon, the best surgeon. He's got training from everywhere and he was with we people for just to learn very good things from our centers. So again I am saying thank you. Okay, thank you.